Welcome back to the Your Health radio and television program. My name is Emily Sciolto from the Monterey County Health Department Public Information Desk, and I'm your host today and every third Monday of the month. We're going to continue this discussion about smoking cessation with my next guest, Ida Corby. Ms. Corby is a respiratory care practitioner and the smoking cessation counselor with the Kick the Nick program from the Community Hospital Monterey Peninsula. Thanks again for joining us today, Ida.
Glad to be here.
It's great to see you.
Nice to see you too, Emily.
So we've talked about the potential dangers of smoking, as you heard, some of the reasons why people smoke, as well as why they're addicted. And now I'd like to focus on quitting. So I'll just ask you, why is it difficult to quit?
Well, I think like Dr. Hernandez was just talking about, nicotine is probably the most addictive substance out there, and it's available. I mean, it's not illegal. You can drive to the store, you can pick up a pack of smokes, and you're not breaking a law. So because of that, because it's so convenient for you, and then to get off of the nicotine, you know, I think that if nicotine was discovered today, there's no way that it would be out there on the market like it is right now. It would be a controlled substance because it really is so addictive. It does do a lot of the results from smoking a cigarette. It really does do what you want it to do. It does calm you down. It does create a sense of euphoria. It is a part of your day, and people use that. And so to give up, you know, that good feeling is absolutely one of the hardest things to do. And if it was easy, I mean, if we could just do, oh, well, look what it does with your lungs and with your teeth, that would be one thing. But because you start smoking usually when you're younger, and because of that, it gets woven into the fabric of who you are, of your day. So you have different things, triggers, like you wake up in the morning and have a cup of coffee, or the phone rings, or you're driving in the car. All those things that just, yes, that's the time that you want to have that smoke. And when it's not there, people really do get depressed, and they do go through withdrawal. And everybody has a different level of withdrawal symptoms, but none of them are what you would choose to go through if you had an option to do that.
Right. It sounds like smoking after, I don't know how long, but after a while it becomes just a part of the program, just a part of the day. It's built in, you know, built into life. It's built into every behavior that you kind of do. And
it's almost your friend. I mean, you know, it's so much a part of your day-to-day stuff. That's the truth.
I have heard people say that it's like losing a best friend when they quit smoking.
Yeah. So again, that's probably what makes it the most difficult to stop smoking. So then there has to be something that occurs within the person that makes them really want to stop. It could be an illness, it could be the birth of a child coming into the family. I mean, there are different reasons that make it happen, but they really have to be ready to go through the different steps of stopping. Now, this is the 21st century, so we do have, you know, medications, and we do have a nicotine replacement, and we can make it a lot easier. In the past, you know, it was cold turkey or not at all, and so the statistics for cold turkey, it's 4 to 7% of people who do it cold turkey can be successful, but 4 to 7, although that's good, it's certainly a lot less than what we would like to see.
Which is 100%.
Yeah,
every person
yes, make it easy.
So we're talking about quitting, and you've mentioned the 21st century, and there's various things to do that you can do and tools available to you to help you quit. But let's talk real quickly about what are some of the immediate health benefits of quitting smoking? You
know, it's amazing. The body really does. It will do everything to try to be the best that it can be. So even within the first 20 minutes of stopping smoking, your blood pressure goes back to normal. The next big step would be like 72 hours. The nicotine's gone from your system. So from that point on, even though the nicotine is gone, you know, you still have the psychological factor of the nicotine, and you remember how it felt. But it's gone from your system, so that's a really good thing. In a year's time, your propensity towards heart disease is reduced by half. And after 10 years, I believe you go back to essentially for heart disease and lung disease of being a non-smoker. Your chances of getting a cancer or heart disease go back to being that of a non-smoker. So the body really wants to repair itself. It wants to get back to the way that it's the healthiest.
That's good to know that even though you've spent however long doing some damage to the body, that it will and it can, get better, almost go back to, in some instances,
Right.
where you were before
The
you
risk
even
of,
started smoking.
Yeah.
That's amazing. That seems to be the biggest payoff,
Yes.
or what would be the biggest
Yeah.
payoff. So what are some of these keys to success I've heard about? We have a readiness assessment that
Right.
you've mentioned,
Right.
and if you do want to talk a little bit about Kick the Nick, the program,
Okay.
you're welcome to do that.
Well, the readiness to quit, like I said, it's a very personal thing. People start smoking, it's a very personal thing, and when they choose to stop, it's also. So I think what's important for people who smoke is, first of all, just learn everything that you can about all the different tools, the nicotine replacement, the drugs, and just kind of let it settle in a little bit. Nobody can ever make you stop smoking. Your doctor can't, your family can't, nobody can. It really has to come from within inside you. So I think empowering you to know that it can't be done unless you're ready to might make people feel a little less threatened, because again, that's their friend, that's their choice of enjoyment, relaxation. So with the Kick the Nick program, what we do is we offer people a half hour to come in and talk to me. There's no charge for it. There's no insurance. It's a gathering of information is what I call it. I will load them up with everything that's out there, and then it's up to them to go home and look through the information and look at the pros and cons for the nicotine replacement. And if they choose to do prescription medication, they would have to talk to their doctor about that also. But I like to just inform them. With anything, the more knowledge you have about something, the better you're equipped to actually combat it or win with whatever it is that you're going to do. Then after that, if they choose to go into our Kick the Nick program, it's very sad, but most insurances do not pay for nicotine counseling. Mm-hmm. So some insurances will pay $100 a year, that's it. So our program is really a self-pay. And the first 4 sessions are the most intensive, because it's at that time that you're setting a plan, what you're going to do. If you're going to do this medication or that nicotine replacement therapy, the bottom line is you're going to be ready to set a quit date. And so that will be done within the first 4 sessions. After that, it's meeting with me on a weekly basis, and it's just like with anything. It's a counselor, it's a coach, it's just somebody that you're accountable to, that not part of the family. You can go in there and say exactly how you're feeling, like this is really not working for me, or I'm having a hard time with this or that, so that we can triage, so that we can help overcome difficult situations. And it's a goal. It's just setting up a goal. And
probably some great tips and advice on how to negotiate some of the steps and the phases that smokers experience when they're trying to quit.
They do. And again, with the drugs and the nicotine replacement therapy, it really, really helps. And there's a combination for all of those, and I won't go into that, but it's just really figuring out what's best for your personality, for your day, and then
all your habits that we mentioned, what's going to work for you. And when you mention, I just want to clarify for our audiences, when you mention nicotine replacement, you're speaking of the patch,
the
gum,
lozenge, or the gum, anything over the counter that you can buy without a doctor's prescription. Now, there's a couple of those that you still need a doctor's prescription, and that's a nasal inhaler, and then there's also one that it's not the e-cigarette. It's the cartridges, but it's FDA approved, but it takes a physician's prescription to get those. They're costly, and I really don't see that the benefit of those is that much better than the ones that you can buy just over the counter.
Okay, so there's a couple different things we can use to remedy or to help out the quitting process.
Easy, yeah.
We can talk about those, or if you want to continue to talk about some of the keys to success that you were mentioning with the program, you can do that. There's so much to talk about.
I know.
Other than quitting smoking, it's fascinating.
Well, the 2 prescription medications, if we were going to talk about that, Chantix is the newest one out on the market, and it was unveiled about 4 years ago this August, so it's been out there for 4 years. And it's a great medication. It's not for everybody, but it actually covers the receptors in the brain that are looking for the nicotine. So therefore, you smoke a cigarette and you're not getting the same kick that you got out of it. So it just makes it easier to come off of the cigarettes or the
Okay.
nicotine.
So it kind of makes you not want them,
Yes.
or your brain at least
Right,
not want them.
exactly, exactly.
Okay.
You know, nicotine, the brain can't tell the difference between nicotine and normal neurotransmitters in our brain. Neurotransmitters are these little messengers that deliver messages to the receptors. So the brain sees nicotine and it says, well, I've got all these neurotransmitters. I need to create more receptors to take in these messages. And so nicotine actually changes the structure of the brain. And that's why when you try to come off of nicotine, now that you've created more of these receptors in the brain, it makes it harder. That's the addictive part of the nicotine.
It wants that many more messengers.
Yeah, where'd you go?
Oh, and so that's the one. Chantix, you mentioned, is the one. It kind of blocks those receptors, and it makes your brain at least not
Yes.
really want the cigarette as
Right.
much. And then the other one you mentioned, or you have?
I haven't.
this
It's
other one?
Wellbutrin.
Oh.
Wellbutrin is actually, it's an antidepressant, but there's a lot of antidepressant medications out there on the market. Why Wellbutrin is the one that works for smoking cessation? It is. That's what they prescribe. So if you do Wellbutrin, it just makes the urge, you know how sometimes when you really are trying to get through that urge, it makes it that much easier not to succumb to smoke a cigarette. And if you do the nicotine replacement therapy with that, so you're putting nicotine in your system, a more healthier way of getting nicotine in your system, and you've got the Wellbutrin on board. So there's a whole process with that. You'll start out at a higher level, stay on that for a month, step down a little bit. It usually takes treatment, usually. The mean time is between 6 and 9 months of treatment to be considered, quote, quote, successful in
And that's
stopping
both
smoking.
of them? For the most part, on average, 6 to 9 months to be rid
yeah.
of the habit.
That being said, there's some people that can quit in like 4 weeks, you know, that's it, they're ready, the little light switch in their brain, they just turn it off and they go along their merry way.
Seems so easy for some of those folks. I'm sure
know.
we all know, you know, at least a couple in our heads that we can
Right,
think of.
right.
But then other folks, it takes, you know, the better part of a year, it sounds like.
Yes, in fact, some people, they say, require treatment up to 2 years even to really be successful. And there's those people that get stuck on, you know, their 3 to 5 cigarettes, and of course 3 to 5 cigarettes is a lot better than a pack of cigarettes. The only thing is, it's just because it's there, you've got it in your mouth, there's another instance that comes up, you're a little stressed out, it's just so easy to ramp back up.
And you have them on hand,
you're
whereas opposed to you wouldn't even have them.
Right, exactly. And you know, that urge to smoke, it will go away. I mean, for that particular time, even if you feel like you're white knuckling it, within 5 minutes, that urge will go away. So if you deep breathe, if you take a big glass of water, you know, go outside and walk for a minute, it'll go away. Not to say that it won't come back, but you know, you beat that one particular urge and it sets you up for success for the next time that it comes along, because you know it's not going to stay there with you. So.
And you know it's going to go away. If anyone's watching or listening right now, just wait. Just hold on. We've got, you know,
Watch
4
the
minutes,
clock.
30
That's
seconds
right.
left to go here. So it sounds like any way you cut it, there's a cold turkey, you know, person out there, and that's going to work. Some people like a nicotine replacement. Some people want to do a prescription. It sounds like most folks use something to help them quit.
Yes.
What do you tell your clients who are, you know, anti-drug, or they want to do it all natural?
Yeah, it can be done, but I think with instances like that, it's really setting up a plan. So, okay, you know, what are you going to do when you wake up in the morning and you want that cigarette? What are you going to do? I will tell you, it's kind of interesting. So people are anti-drug, they don't want to do this, and yet if you look at all of this stuff, and you have a picture right
And
there
I'll show it here.
of all the different ingredients that are in a cigarette, and yet they do not want to do a prescription medication or nicotine replacement that will help them combat, you know, taking in, ingesting in all this other stuff in there. I mean,
some of these other things, arsenic, carbon monoxide, methanol, acetic acid, and they want to quit all naturally.
Yes. And I want to quickly say too, so people that they're smoking the light cigarettes, I want to tell you that's really a misnomer, because they can still get the same amount of nicotine from that, be it either a 0.5 milligram up to 2 milligrams with a light cigarette. The tobacco industry can advertise that because they have smoking machines that draw the smoke out and they can analyze it. But these are machines. When you put that cigarette in your mouth and the filter, which is where they have all these little air holes in there, saliva fills up those little air holes, and from that point on, you're taking in the same amount of nicotine as if you were smoking a regular cigarette.
Wow.
So don't be fooled.
And, you know, that's fascinating. We won't be fooled. We heard about advertising earlier and about how, you know, some of those, you know, issues can play on you and kind of draw you in. Well, wow, I certainly didn't expect to hear that light cigarettes are not light at all, or they don't have to be.
Right.
That's very interesting. Well, thank you so much again, Ida.
Thank you, Emily.
You've given us some really useful info for folks who may be contemplating quitting, or maybe who have recently quit, or even those who may be maintaining their smoke-free lifestyle. These messages have been reinforcing, for me personally at least. So at this time, we're going to take a short break. Again, not a smoke break. The 5 minutes still aren't up yet. So this is Your Health Radio and Television program, and don't touch that dial. We'll be back in just a minute.